Mirtazapine is one of the antidepressants that is popular under the brand name Remeron. It is available as a tablet, but this tablet is available in two types. It is available as an immediate release tablet under the brand Remeron. This tablet is going to be broken within the stomach to release the medication. Additionally, it comes in the form of an orally disintegrating tablet that dissolves effortlessly in water. It is intended for people who are having difficulty swallowing. This orally disintegrating tablet is available under the brand name Remeron Salt Tab. Mirtazapine can be used for the treatment of variety of conditions. It can be used for the treatment of depression as well as for anxiety disorders. For the treatment of anxiety, other medications like benzodiazepines can also be used. Mirtazapine has the suffix azapine, which is just similar to benzodiazepines, but actually it is not a benzodiazepine. Benzodiazepines have two different suffixes. They can have the suffix azepam like diazepam or azolum like alprazolam. Before taking this mirtazapine, you should know important facts. How many days it may take to relieve the symptoms, how it works, what is the dosage, what is its effect on weight, when to avoid this medication, and what are the important side effects. All these points we will cover in this video. First of all, let's see how it works. Mirtazapine can elevate the levels of a few neurotransmitters in your brain. Within the brain, different types of neurotransmitters like serotonin, norepinephrine, and dopamine play a key role in controlling mood and behavior. Mirtazapine is mainly increasing the levels of serotonin and norepinephrine within the brain. However, it is not inhibiting their reuptake. Therefore, it is not an SSRI or SNRI. Instead, it is going to act on presynaptic alpha-2 receptors. Presynaptic neurons store norepinephrine, which is released by calcium-mediated exocytosis. However, the release of norepinephrine is also controlled by alpha-2 autoreceptors. They inhibit the release of norepinephrine. Mirtazapine blocks these presynaptic alpha-2 receptors. Therefore, when action potential reaches to the presynaptic neuron, these alpha-2 receptors are not able to inhibit the release of norepinephrine. Consequently, calcium enters the presynaptic neuron, leading to exocytosis and release of norepinephrine. In this way, mirtazapine increases the levels of norepinephrine in the synapse, which increases postsynaptic activation. Similarly, this medication acts on serotonergic neurons to increase serotonin release. It also blocks histamine H1 receptors that induce sedation and sleep. Even it blocks 5-HT2A and 2C receptors. All these collectively produce antidepressant action. Second one, time for action. Mirtazapine can act on the brain and it can increase the serotonin and norepinephrine levels. However, it is not producing an immediate reduction of depressive symptoms. Even the exact mechanism is not clear, but elevated levels of these neurotransmitters bring a functional change to relieve symptoms of depression and anxiety. Therefore, it takes around 4 to 6 weeks to show beneficial effects. Third one, clinical uses. Mirtazapine is particularly used for the treatment of depression and it is more suitable for elders. This medication can produce sedation, which is an advantage for the elders to induce the sleep. Mirtazapine can be combined with other drugs like SSRIs, selective serotonin reuptake inhibitors, and SNRIs, selective norepinephrine reuptake inhibitors. For example, venlafaxine can be combined with mirtazapine. Similarly, mirtazapine can be used for the treatment of anxiety disorders like generalized anxiety disorder or obsessive compulsive disorder. Even it can be used in the treatment of post-traumatic stress disorder. In all these anxiety disorders, mirtazapine can reduce the anxiety as well as it can induce the sedation. Mirtazapine can also be used to treat hot flashes as an off-label purpose. Fourth one, dosage. For the treatment of depression, mirtazapine can be started at a low dose of 15 mg given once daily. It is preferred to be taken in the evening as this medication can induce sedation and sleepiness. The dose can be slowly escalated based on the reduction of symptoms, and the maximum dose is 45 mg. However, in few other conditions, the maximum dose can be reached up to 60 mg. For treating anxiety disorders, mirtazapine can be given at 15 mg at bedtime. The dose may be increased over a few weeks based on response to this medication. Similarly, for treating hot flashes, it can be started at 7.5 mg once a day. Next one, effect on weight. Mirtazapine can increase the appetite. Therefore, use of this medication can increase the risk of weight gain. This is one of the important side effects that was observed in many people when it was used for a long duration. So for people who are taking mirtazapine, high calorie food should be avoided. Instead, fruits and vegetables should be taken to reduce calorie intake. Proper exercise can also limit increases in body weight. Next one, is it TCA? TCAs are the tricyclic antidepressants. These are the old generation antidepressants, and they include many drugs like amitriptyline, imipramine and clomipramine as a few examples in this category. But mirtazapine is not a TCA. It is a new generation antidepressant. Even though it is a cyclic antidepressant, it is not tricyclic. Instead, it is a tetracyclic antidepressant. So it is having 4 rings. TCAs are old generation drugs and they have troublesome side effects. They have anticholinergic side effects like urinary retention, dry mouth and constipation. They also cause sexual dysfunction. They interact with many drugs leading to difficulty in their use. However, mirtazapine lacks these troublesome side effects and significant interactions. Next one, side effects. Mirtazapine produces side effects like sedation, sleepiness and dizziness in the people. It can also induce nausea and weakness. Other side effects like dry mouth and constipation are also observed. These two are the anticholinergic side effects. However, they are mild and not more pronounced like TCAs. Mirtazapine can increase appetite, which may lead to weight gain. Abnormal dreams can also be observed with this medication. When to avoid this medication? Mirtazapine should be avoided in people who are at risk of epilepsy. Even though it is not directly related to the induction of seizures, use of this medication in people with high risk of epilepsy may increase the further risk. Similarly, mirtazapine should be avoided in the people with glaucoma. As this medication blocks cholinergic actions, it can increase intraocular pressure and may increase the risk of glaucoma. In people having very low blood pressure, again this medication should be avoided. Finally, mirtazapine is contraindicated in pregnancy. Therefore, pregnant women and women liable to be pregnant should avoid this medication. What are the serious side effects? Mirtazapine can produce a few serious side effects which are rare and observed only in a few people. Development of any symptoms like sore throat, fever, oral ulcers and rhinitis may indicate a granulocytosis. It is a condition of reduced neutrophils in the blood that increase the risk of infections. So if you observe these symptoms, immediately blood count should be checked. However, this side effect is rarely related to mirtazapine. Another serious condition is the serotonin syndrome. It is associated with muscle rigidity, fever, hallucinations and tachycardia. The serotonin syndrome is associated with people who have elevated levels of serotonin. It may be possible when mirtazapine is combined with other drugs like SSRIs that elevate the serotonin levels in the body. However, this is a rare side effect produced by mirtazapine when it is used alone. So that's all about the different facts about mirtazapine. It is one of the atypical antidepressants with unique action. I hope this video is useful to you. Thank you for watching this video.